Right now, I'm gonna get me some eggs, some protein, which is healthy for you. An order of eggs and an order of bacon.
He went to McDonald's. I don't think that that's on the menu.
I hurt a lot. I got lymphedema on my leg. I'm tired and I'm wore out. I'd rather be a dead man than have to live like this the rest of my life.
I don't know why, but on My 600 Pound Life, they always start out with the subject that they're profiling, taking a shower. I mean, I think for so many people it would be embarrassing. I mean, I would be embarrassed if they took a video of me taking a shower to start off some type of a show. But I guess it does show you some of the difficulties that they're dealing with. And you can see that huge lymphedema mass on his leg. We'll talk a little more about that as this show goes on.
My wife was murdered. And it just floored me. She was a good person. My best friend. I just couldn't take it, so I turned to food.
Oh, wow, how devastating. Now, I've been married, 22 years now, and I just would not be able to imagine how I would react if something like that happened to my wife. One of the things that we see in medicine all the time is that traumas like this, I mean, severe traumas like this, can really impact how you live your life. And it doesn't just impact you right after it happens, but it can impact you decades and decades later.
After my first wife died, I never thought I'd find anybody else. But then I met Nissa.
The main thing that really upsets me is putting a lot of strain on my wife.
We don't have an intimate relationship. Our marriage is much more caregiver, patient. I just feel like a servant.
This is something that you do see when somebody is so large that they can't take care of themselves, is that essentially their spouse, their loved one, becomes a caretaker because they cannot sometimes do those activities of daily living. I do wonder also in his situation how much his past trauma, the death of his first wife, has impacted how he's acting today.
So you're over 600 pounds, huh?
Yes, sir.
Surgery only does one thing. Keep him from eating a lot at one time. You still can eat all day and he can gain 10 pounds.
Bariatric surgery is the term used to describe surgery to help people lose weight. And right now there are three main types of bariatric surgery being performed. The first type is a lap band, where you basically undergo an operation where a ring or a band is placed around the stomach to make the stomach smaller. This band can be removed, and it's not a popular operation anymore because it does have a higher risk than the other two operations of people gaining their weight back. The other two operations are a gastric bypass and a gastric sleeve. Both of these operations surgically make the stomach significantly smaller. In a gastric bypass, the stomach is reduced to the size of a golf ball. That's it, literally a golf ball. In a gastric sleeve, the stomach is reduced to the size of a banana.
Honey, we're having Alfredo chicken tonight, and you're having chicken broth. I'm sorry.
Sure.
Are you getting tired of the diet yet?
Nope.
Have you been cheating, dear?
No, ma'am.
One of the things that Dr. Nowzaradan from My 600 Pound Life does is he tests his patients before operating on them, which I think is a good idea. Having bariatric surgery is not a simple solution to weight loss because you can eat through a bariatric surgery. Even though your stomach is made smaller, if you don't have the willpower to reduce how much you eat, you can gradually enlarge that stomach and gain the weight back. So by testing his patients in this way, he makes sure that they're going to be a good candidate for the surgery and they have a better chance of being successful.
Face me, okay?
All right, so we get you prepared for your operation, okay?
Yes, sir.
Chuck, he demonstrated that he can control his eating habit, and I think he's ready for surgery.
You got to hand it to him. He just lost 30 pounds by going on a liquid diet, and this sets himself up well for the operation. The heavier you are at the time of the surgery, the higher the risk of complications. And these complications that you're at higher risk for is bleeding, infection, blood clots, and so much more. Now, the risk of a serious complication from this type of operation is about 4%. And that risk is lower than the risk of him kind of staying the way he is and developing a major medical problem from it.
Stomach that we're going to create for Chuck is going to be 2 to 4 ounces, and he won't be able to eat more than that. So that's going to limit his intake, and he's going to lose weight.
Dr. Nazardin is performing a gastric bypass on Chuck. And this is an operation where you basically reduce the size of the stomach to that 2 to 4 ounces, which once again I mentioned earlier is about the size of a golf ball. Now, in addition to forcing him to eat less food at one time because his stomach is so small, this surgery also reduces the output of ghrelin, and this is a hunger-stimulating hormone, so he hopefully will feel less hungry afterwards as well.
I thought the surgery would take away my cravings, but it hasn't been that simple. I'm eating less, but I still like good food that tastes good.
Right now, I'm gonna get me some eggs, some protein, which is healthy for you, an order of eggs, and an order of bacon.
He went to McDonald's. I don't think that that's on the menu. After you undergo gastric bypass surgery, your diet changes quite a bit in the initial postoperative period. You start out for the first week or two just drinking liquids, then you progress to kind of pureed foods and blended foods, and it literally takes 2 months before you're allowed to eat solid food.
It's really frustrating to see him not do what he should be doing. He's cheating, he's throwing up and getting sick.
I'm sick of excuses. I'm sick of doing everything by myself.
I just don't think I can count on him.
She shouldn't let me go like this. I don't want to be alone.
It sounds like there are more issues in their relationship than him just being overweight. Now, she mentioned that he was doing things, he was cheating and doing things to cause himself to throw up and to get sick. And this may be due to dumping syndrome. Dumping syndrome is a name given to a condition where if after this operation you eat too much too quickly, and this can cause the food to go from the stomach to the small intestine too rapidly. This can cause a person to throw up, to have severe abdominal pain and cramping, and to get diarrhea.
This past month, it's been tough. I always thought it was my weight that was the issue. But the very reason I put the weight on is because of what I haven't dealt with. I realize so many of my issues come from not dealing with the death of my first wife. I know I have to come to terms with that to get my life in order.
I strongly believe that most, if not all of us, can benefit from therapy, at least at certain points in our lives. And it looks like in this situation, Chuck could definitely benefit from therapy, both marriage counseling, so he and his wife, but also therapy just for himself to go through and to process the horrible trauma that he went through with the death of his first wife. If you or somebody that you love is undergoing a difficult time, please consider therapy. It can be life-changing, and there's so many options for you out there, from seeing your family doc to get referred to a psychologist, even BetterHelp, which I have mentioned in some of my previous videos, can be a great resource.
I'm excited to see the doc. I used to dread it. When I know I go in and see that weight loss, that's exciting to know how I'm doing. Last time I was here, I was 508.
Wow, that's awesome. He's lost over 300 pounds after his gastric bypass. So far, this has worked really, really well for him. Now, when people undergo these bariatric operations, when it's successful, they can lose anywhere from 50 to 75%, sometimes even more, of their excess weight. Obviously, the key, though, is keeping it off, and that's going to come down to him and his lifestyle choices. But I'm really, really excited for him that he's been able to do this for himself.
Chuck, you are doing excellent. Let me see, how is your lymphedema in the leg?
That grosses people out to see that, I'm sure.
And I want it off of there.
Chuck is doing very well. I think it's time for Chuck to have skin surgery.
When you lose massive amounts of weight like Chuck has, the skin itself does not shrink down. There is a belief that people have that is completely false, that if you exercise, if you do weights, you work out, the skin is going to shrink due to your exercising, and that just is not true. If you've got good skin elasticity, yes, your skin can retract some, but in a situation like this where you've lost several hundred pounds, the skin is going to naturally sag, and that's where plastic surgeons come in and actually cut that skin out.
This is giving me another shot. We're getting along good.
Chuck and I have been apart for a while, but he's made a lot of progress and he's getting better.
Yeah.
You're gonna be okay.
I love you.
I put the divorce on hold. I want to see if we can try and make things work.
I really hand it to her for sticking through this and for staying with Chuck. It sounds like Chuck was not a good husband to her probably all of this time, and that the tragic death of his first wife really contributed to a lot of his issues. But I'm so impressed with Nissa and her character that she's sticking with him and helping him to better himself. I'm hoping that this turns out to be a really happy ending.
Chuck has a lymphedema mass I'm going to take off today. This is very major surgery. These masses are very vascular.
Oh my gosh, his lymphedema mass reminds me of a huge jackfruit. If you're not vegan or vegetarian, you may never have heard of jackfruit, but this is a type of fruit that is used actually in place of pork for vegans. And you can make actually barbecue jackfruit that tastes like pork sandwich. Now that being said, it is not jackfruit hanging from his leg, it is lymphedema. And lymphedema is a condition where your lymphatic vessels and your lymphatic drainage gets clogged up. And this can create swelling in the legs. In really severe cases, like in Chuck's, it can even become this huge mass. The treatment for it is weight loss to reduce that lymphedema, to allow those lymphatic channels to once again work again, as well as cutting those masses off.
This lymphedema mass is interfering with his walking.
25 pounds.
I think he's going to be very happy. He was having difficulty walking with that.
Slide.
Can you imagine a 25-pound weight hanging from your leg and having it for so many years and then it coming off? I'm really, really excited to see how Chuck is able to walk after this is taken off. It is very, very impressive.
I'm ready to move forward with the rest of my life.
It's good. I want to jump up and down. I did way better than I expected to do. I've lost over 400 pounds and I'm real proud of myself. A year ago, I seen myself as a walking dead man. I'm proud that I did what I did to lose the weight.
Wow, that is such an awesome ending, and I'm so happy for Chuck. And I'm really impressed with Nissa and everything she's done to support him in this whole journey of his. But unfortunately, not all spouses are supportive of somebody who weighs 600 pounds. And there are even some husbands who belittle their wives for being heavy and trying to improve themselves. In fact, I reacted to a recent episode of My 600 Pound Life where a young woman who is 600 pounds dealt with not only her weight, but her husband who treated her like garbage. It really is a transformative story that I think you're gonna really love if you love My 600 Pound Life. Take a peek at it right up here. It's gonna warm your heart because her story is one of courage and inspiration. And remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.